The easiest way to forget your pain is a painkiller that looks innocent and is also present in your first aid kit, not bad in moderate cases. But when you grab one for a headache or a sore back without thinking twice. However, taking these common meds regularly can quietly hurt your kidneys while you feel fine. This slow damage happens in the background, and many people never realize there is a problem until it becomes serious. And in this video, we will show you which over-the-counter options carry the biggest risks. We will also discuss better ways to manage your aches so your body stays safe and strong. The chemistry of relief versus filtration. Let's get into the actual mechanics of why that pill you just swallowed might be a double-edged sword. When you have a headache or a swollen ankle, your body is producing these specific enzymes called KIOX-1 and KIOX-2. Think of these as little factories that pump out prostaglandins. Now, in your head or your ankle, prostaglandins are the villains because they cause the swelling and the throbbing pain that makes you reach for the medicine cabinet. But here is the catch. Inside your kidneys, these same prostaglandins, specifically the ones we call PGE2 and PGI2, are the absolute heroes of the story. They are responsible for renal hemodynamics, which is just a fancy way of saying they keep the blood flowing at the right pressure so your kidneys can actually do their job of filtering out toxins. To understand the danger, you have to look at the afferent arteriole. This is the main intake pipe that brings blood into the nephron, which is the functional unit of your kidney. Under normal circumstances, those prostaglandins act like a signal to keep that intake pipe wide open. It is a process called vasodilation. However, the moment you drop an NSAID into your system, the drug doesn't just go to your headache. It travels everywhere. It shuts down the COX enzymes in your kidneys too. Suddenly, the signal to keep the pipe open vanishes. The afferent arteriole begins to tighten and constrict. Imagine trying to water a massive garden, but someone is standing on the hose. That is exactly what is happening to your nephrons. They are being starved of oxygen and nutrient-rich blood because the emergency valves have been forced shut by the medication. Over time, this lack of blood flow causes the delicate tissues in the kidney to suffocate. This isn't just a minor glitch in the system. It is a fundamental shift in how your body manages its internal plumbing. You are essentially trading a temporary relief from minor pain for a state of ischemia, which is medical talk for tissue starving from lack of blood. Most people think their kidneys are fine because they aren't feeling a sharp pain in their back, but that is the scary part. The filtration process is getting sluggish, and the pressure inside those tiny units is dropping, all because the chemical signals that maintain balance were silenced. Your kidneys are trying to run a marathon while someone is holding their breath. This mechanical strangulation is the primary reason why doctors get so nervous when people pop these pills like they are candy. It is a direct interference with the life support system of your renal cells. NSAIDs versus acetaminophen. So, who are the main players in your medicine cabinet? You've got the heavy hitters like ibuprofen, which you probably know as Advil or Motrin, and naproxen, commonly sold as Aleve. These are your classic NSAIDs. Then you have the old-school aspirin. All three of these share the same search and destroy mission against those COX enzymes we talked about. Ibuprofen is usually the go-to for quick relief, while naproxen is the long-distance runner because it stays in your system much longer. But here is the thing about aspirin. Even though it is often used in low doses for heart health, in higher doses for pain, it still puts that same squeeze on your kidneys' blood vessels. It is a common mistake to think that because a drug is sold at every gas station and grocery store, it must be totally harmless. In reality, these are potent chemicals that alter your internal physiology. If you are taking naproxen every single day for a sore back, you are essentially keeping those kidney pipes constricted for 24 hours a day, never giving the tissue a chance to breathe. Then we have the outlier, acetaminophen, which most people know as Tylenol. This one is a completely different beast. It doesn't really mess with the prostaglandins in your kidneys, so it doesn't cause that strangle effect on the blood flow that NSAIDs do. This makes it a much safer pick for your kidneys if you are just dealing with a standard fever or a light ache. But don't go thinking it's a free pass. Acetaminophen has its own dark side. While it leaves the blood vessels alone, it is processed through a different metabolic pathway that creates a nasty byproduct called NAPQI. Normally, your body can neutralize this stuff easily, but if you take too much or if your system is already stressed, NAPQI causes oxidative damage. It is like a chemical corrosive that eats away at the cells. So, while the NSAIDs are starving the kidney by cutting off the blood, acetaminophen can burn the kidney through chemical stress if the dose is too high. It's a classic case of picking your poison. You have to understand that pain relief is never a zero-sum game. Every time you interfere with your body's natural signaling, there is a cost. Whether it is the mechanical constriction from an Advil or the metabolic byproduct of a Tylenol, your kidneys are the ones paying the bill. Understanding the difference between these two categories is the first step in making sure you don't accidentally wreck your long-term health while trying to fix a short-term problem. Chronic interstitial nephritis. Imagine your kidney tissue as a lush, flexible sponge designed to filter your entire blood supply every few minutes. Now, imagine what happens when that sponge starts turning into a brick. That is the essence of chronic interstitial nephritis. It is a terrifyingly quiet process where the slow burn of constant pill popping creates a state of permanent inflammation in the spaces between your kidney tubules. This isn't like a cut on your skin that scabs over and heals. This is more like pouring a tiny bit of acid on a silk rug every day. At first, you don't notice a thing, but eventually the fibers break down, and the damage becomes the rug's new reality. This transition from a simple irritation to full-blown fibrosis is where the danger lies. Fibrosis is just a medical term for scarring, and once kidney tissue scars, it is essentially dead. It can no longer filter, it can no longer regulate your blood pressure, and it certainly cannot be reset back to health. The most graphic part of this slow burn is a condition called papillary necrosis. Think of the renal papillae as the tiny, delicate exit points where urine drains from the kidney's inner structures. When you starve these areas of blood flow over and over again, the tissue actually begins to die and slough off. It is quite literally the physical shedding of your kidney's internal components. These dead pieces of tissue can actually break away and block your urinary tract, causing pain that mimics a kidney stone, but the cause is far more sinister. It is the result of years of cumulative damage. Researchers often point to the 2 kilograms rule as a terrifying benchmark. Studies have suggested that if a person consumes a cumulative lifetime dose of 2 kilograms of certain painkillers, which sounds like a lot, but adds up quickly for chronic back pain sufferers or migraine patients, their risk of reaching end-stage renal failure sky jumps. That is roughly the weight of a couple of bags of sugar, and for many, that limit is reached by middle age without them ever realizing they were on a countdown. Every pill you take is a tiny deposit into that 2 kilogram bucket. Once that bucket is full, the slow burn stops being a hidden process and becomes a medical emergency that changes your life forever. You aren't just taking a pill for a headache, you are potentially trading pieces of your internal filtration system for a few hours of comfort. High-risk groups. If you think everyone reacts to a painkiller the same way, you need to think again. For some people, taking a standard dose of ibuprofen is like playing Russian roulette with a fully loaded chamber. The stakes are highest for those already managing high blood pressure or diabetes. Why? These conditions already put a massive amount of silent pressure on the tiny blood vessels in the kidney. If you have hypertension, your kidneys are already fighting an uphill battle to manage the force of blood flow. When you introduce an NSAID that constricts those vessels further, you're essentially choking a system that was already gasping for air. It's a compounding effect. For diabetics, the high glucose levels in the blood act like shards of glass, slowly damaging the filtration units. Adding a regular habit of painkillers to that mix is like throwing gasoline on a smoldering fire. The slow burn doesn't just crawl in these cases, it sprints. Then there is the athlete's trap, which is one of the most overlooked tragedies in sports medicine. Imagine you are running a marathon or hitting a heavy session at the gym. You are sweating, you are slightly dehydrated, and your body is shunting blood away from your kidneys to feed your working muscles. This is a natural, temporary state of stress. But then you feel a twinge in your knee or a throb in your head, and you pop a couple of anti-inflammatories to push through the pain. This creates the absolute perfect storm for acute kidney failure. And your kidneys are already desperate for fluids because of the dehydration, and then the medication steps in and slams the intake valve shut. You are effectively cutting off the water supply to a burning building. We see healthy, fit individuals end up in the ER with sudden renal shutdown simply because they didn't realize that NSAIDs and intense exercise are a toxic combination. It isn't just about how much you take, but the environment your body is in when you take it. If you are dehydrated, older, or managing a chronic condition, that innocent-looking pill becomes a high-stakes gamble that your kidneys simply cannot afford to lose. Mixing meds. Think of your kidney as a high-tech pressure chamber. To stay alive, it has to maintain a very specific internal tension. And it manages this by balancing two faucets, one that lets blood in and one that lets blood out. Now, imagine a scenario where 3 different medications all decide to mess with those faucets at the same time. In the medical world, we call this the triple whammy, and it is one of the most common ways people accidentally destroy their kidneys. This happens when you mix a common NSAID, like your usual painkiller, with a diuretic and an ACE inhibitor, which are standard blood pressure meds. Individually, these drugs do their jobs well, but when they meet in your bloodstream, they form a toxic alliance that collapses your kidney's internal pressure system. Here is the play-by-play of the disaster. The ACE inhibitor steps in and forces the exit pipe wide open, meaning blood is rushing out of the kidney too fast. Then, as the diuretic kicks in and lowers your overall fluid volume, making the blood supply even thinner. Finally, you take that painkiller for a headache, and it slams the intake pipe shut. Now, you have a situation where no blood is coming in, and whatever was already there is being drained out at high speed. The internal pressure, which is vital for the filtration of toxins, simply vanishes. It's like trying to run a hydroelectric dam when the river has dried up and the gates are stuck open. The kidney can't filter a single drop of waste, and the cells begin to die from the sudden pressure drop. Many patients don't realize that their blood pressure routine and their pain management routine are actually in a violent tug-of-war where the only loser is their renal health. This isn't just a side effect, and it is a total mechanical failure of your body's plumbing caused by a lack of communication between different pill bottles. Hidden symptoms and lab tests to watch. The most terrifying thing about kidney damage is that it is a master of disguise. You can't feel your kidneys getting tired. You don't get a warning ache or a sharp signal when things start to go south. In fact, most people feel absolutely fine, totally normal, until they have already lost about 60% of their total kidney function. Your body is incredibly good at compensating, right up until the moment it can't anymore. This is why you have to stop looking for symptoms and start looking at the data in your blood work. You need to become your own health detective and understand two specific numbers: creatinine and eGFR. Now, creatinine is a waste product from your muscles that your kidneys are supposed to pee out. If your blood work shows your creatinine levels are creeping up, it means the filter is getting clogged. But the real gold standard is your eGFR, or estimated glomerular filtration rate. Think of this as your kidney's efficiency score out of 100. If your eGFR is 95, your filters are high-performing athletes. If it drops into the 60s, you are officially in the danger zone of chronic kidney disease. You might still feel great, you might still have plenty of energy, but the math doesn't lie. Your kidneys are struggling to keep up with the trash. If you are a regular user of painkillers, you cannot afford to skip these tests. Reading your own lab work is the only way to see the damage before it becomes a permanent, life-altering diagnosis. And it is the difference between catching a small leak and coming home to a flooded house. Safer alternatives and pain management. If your joints are screaming or your back is out of alignment, you don't have to just sit there and suffer in silence. The goal is to be smarter than the pain. One of the biggest game changers is the shift toward topical NSAIDs, like Voltaren gel. When you swallow a pill, it has to travel through your stomach, hit your liver, and circulate through your entire bloodstream before it reaches your sore knee. Along the way, it wreaks havoc on your kidneys. But with a topical gel, you are applying the relief directly to the source. Research shows that these topicals have about 95% less systemic absorption than oral versions. This means your knee gets the medicine, but your kidneys barely even notice it's there. It is a targeted strike instead of a carpet bomb. Beyond the medicine cabinet, you have to look at your lifestyle as a form of internal maintenance. Switching to a Mediterranean-style diet isn't just about weight. It is about flood control for inflammation. By loading up on omega-3 fatty acids from fish and antioxidants from greens, you are naturally lowering the heat in your body without needing a chemical intervention. Combine that with physical therapy to fix the actual mechanical cause of your pain, and suddenly you aren't just masking symptoms anymore. You are building a body that doesn't need to rely on a bottle of pills just to get through a Tuesday. It's about playing the long game with your health. A conclusion and action plan. The golden rule for your first aid kit is simple. Treat these meds like a fire extinguisher, not a daily supplement. They are for emergencies only. If you find yourself reaching for a bottle of ibuprofen for more than 3 days in a row, it's time to stop and ask why. Your safety protocol should always prioritize hydration. Never take an NSAID if you are parched or just finished a heavy workout. Always swap to acetaminophen for simple fevers. And if you have blood pressure issues, consult your doctor before even touching an anti-inflammatory. Your kidneys are silent workers, but they aren't invincible. By making these small shifts today, you are ensuring that your body's filtration system stays strong for decades to come. If you found this breakdown helpful and want to protect your health with more science-backed tips, make sure to hit that like button and subscribe to the channel. Sharing this video could literally save a friend's kidneys, so pass it on. Thanks for watching and stay healthy and